tunawauliza madaktari wetu warudi kazini. Wale wanataka kurudi kazini tutafikia kuwa protect, na mtu yeyote atafanya kazi atalipwa, sababu kulikuwa na court order yenye ilisema madaktari warudi kazini, lakini wamekataa kurudi kazini. Kwa hivyo tunawasihi wenye warudi na tutaendelea kuwalipa. Asante. Ya 175. Out of those 75 wako kazini. Hao ni wale either wako kwa management, kuna wengine wako study leave, na hao tunawalipa. Hao wachache wenye wamebaki wakirudi kazini pia wao tutawalipa. Hakuna mtu atakataa kulipa. Asante.
It is a very sad day to realize that even after doing all this we have done for our doctors, they are still persisting with the strike. The management, the executive, has called the doctors' union for endless meetings meant to resolve the stalemate. No dividends have been forthcoming to date. A few days ago, 2 days ago, we appeared to be inching very close to striking a deal, since it was very clear to the union that all these issues had been addressed. For the record, the only issue that the doctors are holding on us is failure to pay salaries for the month they have not been working. I want to repeat that again. The only reason our doctors are not back in office today is because they are demanding to be paid salaries for months they have not worked for. I pray to be told who on earth expects to be paid, to be remunerated for duties they never performed. These are public resources. What they are calling their salaries are public resources. We have a duty to protect public resources, and if any one of them is lying to themselves that we are going to pay salaries for days not worked, they had better think twice. That is not about to happen. We will not pay for the days not worked. Take it to the bank. I have just noted, though in passing, that we are paying some of the union officials, and I want to call out the chairman of KMPDU, Dr. Okumu. Wherever you are, you know you are earning your monthly salary because you are on study leave.
Last 5 years.
For the last 5 years. Dr. Okumu, you are misleading the membership of KMPDU when you are taking your salary home, when you can feed your family. Dr. Okumu, drop that stance, come out and tell the public truth. One day, one time, Dr. Okumu, you'll be called to account for the monies you are taking without providing services to the people and encouraging others to stay out when you know you are getting your pay. I wish to say this again. We are not ready to talk about paying salaries for days not worked. And if anybody thinks they are going to hold us down on that, they are deeply mistaken. They'll have to think twice. We are not about to move 1 inch. We will not move 1 inch. And let me say this, for those doctors who are willing to come back and work, we have no problem with that. For those who want to stay put, go ahead and stay put. It is okay. I want to say this again. For the last few months, we have pursued a performance management documentation, and review meant to establish what exactly is the performance level of our doctors here. For the record, I want to tell our doctors this. A day is coming when we will call you out by name to stand out and tell the people of Machakos what you have done as a doctor earning your salary from here, how many patients you have seen this year. That announcement everybody will have to make. We will make those public so that the public can judge us. From wherever they are, they know that is the position. They know that is what we are doing. And they also know that one of the reasons why some of them feel so aggrieved is because we are ruthlessly pursuing that path of forcing management accountability, performance accountability. We will not relent. Indeed, we will tighten the bolts. A promise I make to you. If you can take it, take it. If you can't, the gates are open kindly. And we want to set the record straight here for the benefit of all. On the 9th of October 2024, our doctors, through their union, KPMDU, issued a strike notice, and that strike took effect from that date, the 9th of October. So to date, that strike has entered its 58th day. Now, I wish it to go on record that the issues that the doctors had raised as per their letter to the government were issues to do with delays in submission of their statutory deductions. Once again, for the record, those are issues that have been resolved. That is an issue that is behind us. From wherever they are, this one they can confirm. Now, I wish to once again establish that promotions for 422 health workers, doctors included, that were pending were already done and were effected in their payslips. That is, they were paid for this. Indeed, payment of arrears for those promoted has been happening since August 2024, this year. And the last batch is being paid this month, December. One of the complaints was about shortage of workforce. I wish to note again that since 85 healthcare workers that have been newly recruited have already reported, and this includes doctors. This exercise was meant to address, to bridge the gap in terms of shortage of health workers. Again, another 325 healthcare workers have already been interviewed, and this includes doctors. And for the record, again, 10 doctors have since reported. Those doctors that were on contractual terms have had their terms of employment converted to P&P, permanent and pensionable. Now, doctors on leave, either annual, study, or maternal, and those in management have agreed voluntarily to report back to work. And this includes more than 50%, including, those doctors who are on study leave. This includes maternity and other leaves that are provided for in law, get their salaries as it were. Now, it is also noteworthy that some of the union officials are getting their salaries, leaving only a few out. I said I wanted to put the record.
Karibuni. We'll take very short time. Sawa.
So, good afternoon, ladies and gentlemen. To give a press briefing, and with me, in charge of health, Waziri Kasivu, with me, public service, public here. And the theme behind this, so we are waiting the outcome of the court process. You see, we want to take things from a legal end. We are waiting for those instructions from the court. The county secretary, serikali na Machakos. Na nina waziri witu wa health mama umundi ni kana tuyenda unene ya yulua strike ya matakitali maito. Tuminondo si kana matakitali maito imethireme on strike ibindani yele. Now kila kwenda uweta ni kimwe kana madhi strike yai itakitali on the mama sako mundo ile baloyi anzia itie de wesineza izune tweketa.
Okuthukuma no kuewa nondu koti ni yawetie ne kwendhiwe na court order mundu utacio kawiyani na koti yaisia nacio kawiyani ndo maiva. Asante sana.